specialization has already happened, right? I mean, it's really upon us. It's been part of healthcare for a long time. But what hasn't been part of healthcare in for many patients is the care coordination between specialists. And in many ways, Amazon Care and what they're doing is kind of providing a level of care coordination that is needed. And so, it's interesting. Is Amazon Care going to really be the doctor? Or is it going to be the care manager? Sunny Terra from Care Cognetics wrote an article on our site, Healthcare IT Today, where he said the care manager is going to be more influential in healthcare than the doctor. And that's not that the doctors become less influential, but it's just the rising influence of the care manager that needs to coordinate the care that you receive across multiple specialists to make sure that the specialists are caring for the entire patient rather than just the very specific chronic need that you have when you go to that specialist. So I
Sure.
think the care manager is going to be interesting, especially in value-based care.
Yeah, I mean, that's a really good point, right? The financial incentive for a primary care doc to quarterback everything doesn't really exist.
No.
And they don't have the bandwidth to do all of the things that your average patient needs, and certainly not patients that have chronic conditions and need to see multiple specialists. So that would make a lot of sense. There's definitely a lot of value in the care management role, and for those of us that have been sick before, having someone that acts not just in a care management role, but as an advocate is a really hard problem to solve for. But once you've found your advocate as a patient that needs it, it feels like the only way you could have gotten things figured out, right? Like, I think many of us have been there where it's just like you're at the end of a rope. You haven't really figured out what the problem is, and you need that advocate to help push you over the finish line and find the care that you need to solve the problem.